Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class health care provided at each of our Regional Health Command Atlantic medical facilities to soldiers, their families, retirees, and other beneficiaries. This month, we bring you the report from the U.S. Army Transportation Museum at Joint Base Langley-Eustis, Virginia, the home of the U.S. Army Doctrine and Training Command, where the Army is shaped through recruiting and training, leader development, research, and analysis. It is also the home of McDonald Army Health Center, where the health readiness of the warfighter and the wellness of family members and other beneficiaries is protected by a world-class team of caregivers and support staff. We will highlight some of the outstanding care available here, but first we'll travel to another installation here in the Tidewater area of Virginia, Naval Station Norfolk. Veterinary services there and at all military installations are delivered by Army veterinarians and veterinary technicians. As this report shows, there's more to this Army vet mission than caring for family pets.
Norfolk veterinary personnel handle the veterinary care and food inspections not only at Naval Station Norfolk, but also at surrounding installations, not only family pets, but their primary mission, the health care of military working dogs.
We get a large number of dogs, not just from Norfolk, but from other places that are en route to Europe and Africa and sometimes even Pacific countries. So we become the experts in readiness for those working dogs.
Norfolk vets monitor the military working dogs monthly, and each receives a semi-annual physical exam.
Everything from nose to tail, we're just checking over to see if there are any abnormalities or things that we need to be looking for, or further diagnosing to see if we have a potential issue with our military working dogs that would make them not ready to deploy.
Military working dogs like Doki serve with handlers, like Master-at-Arms Second Class Joshua Abraham. He is confident in the care Navy dogs get from Army vets.
They're very helpful and open about care for our dogs. The military working dogs are the number one priority for them from my experience. So anytime we need anything, just a quick phone call, it's taken care of.
The food inspection mission carried out by the Norfolk Veterinary Branch is also important. Inspectors evaluate food packaging, storage, and identify unsanitary conditions. More than 400,000 people within a Tidewater area expect safe food at area commissaries and installation eating establishments. The military loses nearly $1 million of work time annually due to employees affected by foodborne illness.
You want to make sure that the person is physically well, that they're not having days out of work when they are sick from eating something that wasn't right for them to eat.
We check to make sure that the grade and the quality is specified in the contract. So we'll look at fat content, the ribs, and we'll go over and we'll pull out a big slab, and before they process it, we'll look at it to ensure that it's not too fatty, it's not too thin, that it weighs the appropriate amount that's specified in the contract.
Food inspectors also check the food that goes on board Navy ships. They even check the safety and taste of meals ready to eat, or MREs. As commander of an Army unit stationed on a naval installation, Dowling knows that inter-service cooperation is essential to mission accomplishment. She is grateful for the Navy's support, which includes a new $8 million veterinary clinic in Norfolk opened in October 2015, and more to come.
The project manager from Navy Medicine East was working on a dozen other projects, not all veterinary, but Guantanamo Bay, Bahrain. They're trying to make sure that veterinary services is supported across all the naval installations.
For the Regional Health Report, I'm Sergeant First Class Aisha Austin.
Budgets are tight across the federal government and the Department of Defense. McDonald Army Health Center is doing its part to control costs while maintaining the quality of care through its operating room optimization plan.
OR optimization is an effort to improve efficiency in McDonald's operating rooms. The goal is to maintain high-quality surgical services and a culture of patient safety first while reducing expense.
The Army is looking at operating rooms and how they are utilizing them and whether they're cost effective. And so we take a look at ours, and we don't want to be at risk of losing one of our ORs or our program here. We are an outpatient operating room, and we'd like to keep it here for our patients and to be able to provide the best care that we can. So looking at that and looking forward, what we've done is we've come up with a plan to better make use of our operating rooms and better utilization.
Plan calls for operating room and recovery room personnel to The team with staff from each service at McDonald connected with surgical cases. They are also reaching out to other military medical facilities in the Virginia Tidewater area. Since the program began last September, OR utilization has increased by 42%.
In some of our departments, such as in orthopedics and ophthalmology, that increase can go up to 76%. So we've seen an increase in every department and also in the teamwork that is going on between the departments, the operating room, Langley Air Force Base, and Portsmouth Naval Hospital.
Increased OR utilization also means McDonald can consider adding new surgical programs. For the Regional Health Report, I'm Ben Scott.
Although the OR optimization program has been successful so far, McDonald officials say the program will continue to search for new ways to improve beneficiary care. Dental readiness is key to soldier readiness. Soldiers with severe dental problems can't deploy, and that makes it more difficult for soldiers to complete their mission. The dental activity combines skilled dentists and technicians with state-of-the-art techniques to keep soldiers ready.
When it comes to unit readiness, dental readiness is fundamental. Soldiers who are not dentally ready are not mission ready, due to their risk of becoming non-combat dental casualties during deployments. The mission of the Fort Eustis dental activity is to provide the care necessary to maintain or restore oral health.
Beginning with the annual examination though, some may just require the examination, some require an exam and a cleaning, some require an exam and further dental work, some require work that might be more extensive.
The Army's Go First Class program is making it easier for soldiers to maintain their dental readiness by reducing visits to as few as possible. Patients can have their annual exam, cleaning, and initial treatment all in the same visit. The Fort Eustis Dentac is leveraging technology to make that happen, including computer-aided design and computer-aided manufacturing, or CAD/CAM. Using CAD/CAM, dentists can create and install ceramic dental crowns during a single visit. The technology is expensive, but invaluable.
So it takes a 6-week-long process to do a traditional crown and consolidates it into 2 hours.
Army Dentistry also has the High Caries Risk Program, which includes oral health by customizing treatment to the patient's needs. It can include nutritional counseling, oral hygiene instructions, and intensive treatment to help prevent future decay. Colonel Evans says that education is your best weapon in the fight for dental health.
Know about oral disease, know about it with your family and with your children, know about your diet and oral habits to keep your mouth healthy. What we need to understand is that your oral hygiene is directly connected to your medical health as well.
For the Regional Health Report, I'm Jerome Banks.
Soldiers here currently meet the Army standard of 95% dental readiness, but Colonel Evans says his unit is working to improve readiness even more. And that's the Regional Health Report for April. Thanks to the Army Transportation Museum and McDonald Army Health Center for hosting us. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.